Hi, welcome everyone. This is such an amazing evening. We are so glad you are here. My name is Dr. Diana Londoño. I am a urologist in Los Angeles, and I'm the founder of Physician Coach Support, which is a platform that is hosting this every month. It's a free and confidential platform where physicians can come for support from a peer who's also a certified life coach. And we are here because we believe really in service and hope, to give hope for others who may be struggling with something and they want to talk to somebody about anything like, any despair, any frustration, any thing that they have to decide upon, and they want to talk to somebody confidentially. That's why we're here. So every month we bring amazing speakers that can help us in different ways or tools to get us to a better place in wellness and get us hopefully out of burnout. So today is no better day than to bring my guest, Dr. Verena Brown, who's here with us. And thank you so much for being here. This is just such an honor. And to have you speak about something that is so critical that I think should have been the first topic of all this, because nutrition is absolutely so essential to well-being. So thank you for sharing your time and your wisdom.
Thank you for having me here, Diana. I'm really, really excited about this.
So tell us a little bit more about you, because you are actually a pediatrician in a very sensitive and difficult role that you have. So tell us more about your role as a pediatrician, and then how it came to all this and to nutrition and your interest and your wisdom about it. So tell us more where you are as well.
Yeah, absolutely. So I'm a child abuse pediatrician. So by training, that's my day job. And what I do is I see kids who have been victims of either physical abuse, sexual abuse, or neglect, and inpatient and outpatient. And of course, as you can imagine, with that job, we see a lot of kids in a period of great crisis in their life, or kids who have had just chronic abuse and therefore chronic trauma throughout their life. And so, that's how I started my career as a baby doctor. And over time, started looking at different interests. So I ended up becoming a health and wellness coach, and then also a certified nutrition coach. And honestly, that came from my own burnout. I know you guys talk a lot about burnout here, and I just needed another avenue to think about life in a different way. And so I ended up getting those certifications. But what's interesting, as life does, your worlds end up colliding in magical ways, if you will. And so what has happened for me is, with being now a trauma-informed coach, I can see what the effects of childhood trauma have on adults. And I mean, there's plenty of literature on it through adverse childhood experiences, the ACEs, that talk about how when you are a kid who has gone through a lot of trauma, your health parameters as an adult, you have higher risk for heart attack, higher risk for stroke, for diabetes type 2, for Alzheimer's, all sorts of issues that you kind of wonder, like, why? How is it all tied together? And so, as I've gone through this journey, I've also become a member of the American College of Culinary Medicine. I love to cook. And so, learning about how do I serve my coaching population a little bit better. But through that, because we are trauma informed, and I do have a lot of adults who have gone through trauma as children, I became very interested in this whole idea of mental health and how your diet and nutrition actually can affect your mental health both positively and negatively. And so, how can we treat the whole person holistically, not just, this is what happened to you, here's a pill, right? Because you've got anxiety and depression and all these other things. And through that too, and looking at my pediatric patient population, because these kids, especially the ones that are chronically abused, they'll come in with all sorts of diagnoses first because maybe they haven't told their abuse story yet, right? But they've been acting out behavior wise or having issues behavior wise. So they'll come in with diagnoses like, ADHD and oppositional defiant disorder and depression and anxiety and all of these loaded onto our kids, and they're, you know, covered in medications by the time that they finally decide to disclose their trauma. And so part of what I'm wondering about, so this is kind of a new start to my journey, is how does that actually play out in post-traumatic stress and then diet and nutrition for these kids also. So that's kind of how my interest initially was divergent and then came together in what I do for my day job, but then also for my coaching job.
Well, yeah, I think it is definitely, full circle. We think it's not related, but it absolutely is. And I love that part. I think for others to maybe kind of listen to that part of, we definitely talk about burnout here. We want to get out of it, but, finding that purpose or finding that hobby or finding that learning about something new, something that gets you up in the morning that you're looking forward to. And again, it doesn't have to be within medicine, or it could be outside of it. Obviously, in this sense, what you did, it did as always was still within the realm of whether it was coaching or whether it was learning about the nutrition part. That looking forward to something is really something that gives you like that hope and gets you out of like that apathy and depression, or all those kind of heavier emotions, and gets you like kind of lifts that, gives you that air, that light feeling. So I think it's so important if we are in that space of feeling just overwhelmed or defeated or a little hopeless, is thinking about what else can you do. And again, does not mean you have to leave medicine, but to have something to give that little purpose. And if not, it's also just remembering, if you're within medicine, like what gave you that purpose, to go into medicine. Remembering that, I think, can be very helpful. So thank you for sharing that, because I think other people may be in that situation and realize they can start thinking in their own life, what could they start? Maybe it's an aesthetic practice, or maybe it's a hobby, or maybe it's more learning, whatever it is that can help them. So I think that was very helpful. And I agree, it's such a big interplay between, all these states of trauma or anxiety, because so many people, when they're anxious, they, stress eat, or they use food as a coping mechanism. And then they may not use the most healthy foods to do that, to help them in their everyday lives with their emotions. Because I think in Western society, the emotions are supposed to be hidden or not talked about. And so how do you cope with them when you are having them? And many people use food. And obviously as children, they may not have a choice of what to eat, but hopefully as adults now, we can talk about, well, now that we are adults, that maybe we had our own trauma, we've lived through it, well, what can we do? And how is that interplay of what we're going to eat going to impact our mental health, and vice versa? If we don't have good mental health, what are the choices we're going to take to then, eat? And, is it going to be nutritious, or is it just going to be to stay away from hunger? So,
Right.
you really had talked about a lot, before, sort of that interplay, between the gut-brain axis. And maybe some people definitely don't know anything about this. And I think, it would be helpful to kind of explain even what that is, and how there is this interplay of the gut and the brain, and how we are whole and connected and not separate.
Yeah, it's really, for me, it's super fun to get down to the cellular level at this, because, when we look at the microbiome gut-brain axis, we're talking about ourselves as human beings, but then we are the host to anywhere between 500 to 1,000 microorganisms in our body at any given time. And that's generally a really, really good thing. We want those in there. And these are bacteria, these are viruses, these are even parasites, which sounds gross, but actually they're really helpful. And, you know, so 99% of the DNA found in our human body is not human. It is microbial, which is like phenomenal. We're like a whole world within our world, which I think it's kind of super cool. But when you look at this axis, if you go back in history, right, I think the first time we really started, obviously people have known for millennia that you have to eat to survive. That's kind of duh. But people didn't really start thinking too much, at least in our modern Western society, about what nutrients do until people are like, oh, listen, if I give this sailor some oranges, they won't have scurvy. What's up with that, right? So, but we've really thought about it in a very disease-oriented way, which is kind of what we do here in the West,
Right.
right?
Yeah.
But in the past 10 years or so, there really has been an explosion, thank goodness, of a lot of research in looking at this little universe that is our gut and how it connects to everything else. And one of the things that I didn't realize until recently is like the ketogenic diet, and I'm not here to talk about the ketogenic diet, but just to give historical context, was actually created about 100 years ago. I didn't realize it was that old. And one of the things that is well known is that it really started out in pediatrics for children who had seizures that weren't really responding to anything else.
Mm-hmm.
So you would put them on the neurogenic diet, and it actually worked. It would decrease these kids' seizures. And of course, the ketogenic diet is very difficult to maintain. If anybody has tried it, it's very hard to do. But of course, for these kids, it really made a difference. Well, as pharmacology became better, and then we had anti-seizure medicines, it's a lot easier to take a pill than to go on a ketogenic diet.
Mm-hmm.
So people don't really think about it too much anymore, except for in small cases in pediatrics where they knew that this was like the key if the other meds weren't working, until there was this explosion of, oh, ketogenic diet, let's go lose weight and whatever. But it really is such a historic centerpiece of how we know that what you eat does affect your neurology somehow. So going back to the past 10 years, there really has been a bit of an explosion of this kind of research. And when we think about this axis, there's a couple of ways that the gut and the brain talks to each other. Right? So we have the central nervous system itself, so the autonomic nervous system. If you guys remember, you have parasympathetic and sympathetic, and the main parasympathetic nerve, of course, is the vagus nerve, so cranial nerve 10. And it's going to, if you guys remember, it modulates respiration, it modulates your heart rate, your immune system in any ways, and it connects to your gut. And so when you look at the vagus nerve, so people who have had vagotomies for peptic ulcers, for example, they have an increase in mental health disorders.
Interesting.
It's so interesting. In mice that they have had vagotomies, they have more anxiety and depression. I'm not sure how you measure that in mice.
Anxiety, maybe depression. Well, I guess maybe they don't move. They don't want to eat. They just like lay there. But yeah, I don't think they have a score thing. But they probably, their brain not as active. But yeah, they probably act different. Yeah, they're not going to be like their normal.
Like sad mice, right? So
Yeah.
and so the other side of things, if you have with vagal nerve stimulation, they actually use that as a remedy for depression that's not reactive to drugs.
Mm-hmm.
So we know that there's something there. And of course, if you look at what the vagus nerve does, it does modulate dopamine, norepinephrine, and 5-HT, which those neurotransmitters, much of those are actually made in the gut.
Yeah, I think that's fascinating. When I learned that, I was like, what? Because we don't learn that in med school. I was learned that it was somewhere in the brain, but it's so crucial, like all the things that we're learning about, again, all these neurotransmitters or all these receptors, both here and there, that are not just in the brain, that they're everywhere. And I guess you'll definitely touch on that. But I think that fact, I mean, some of your things you're saying are like, wow, but these are too as well. I'm like, wow, like it's in the gut, it's made here. Or you mean like it's so powerful here? So I think that's why it's important to feed the good bacteria that is there, so they can be happy and produce more of that. But you'll definitely talk about that. But it's so interesting.
It's so interesting. The same thing with serotonin. So 90 to 95% of the serotonin that's made in your body is actually made in your gut through the tryptophan pathway, because tryptophan is a precursor to serotonin. But what's interesting is that, and this is when we get into the microbiome, right? So all of those organisms that we talked about, they have grown into the symbiotic relationship with the human host for thousands of years. So we know each other pretty well if we have a good microbiome. and we help each other out, right? And so what they're actually doing is the metabolites that they make to keep themselves fed either mimic a lot of the things that we need in our own body, such as neurotransmitters, or they actually stimulate the production of neurotransmitters.
Mm.
And so we know that if we have those healthy bacteria, we are going to be helping to stimulate, for example, serotonin production or dopamine production or things like that. Where if you look at germ-free mice, so these are mice that over, time they've stripped away their gut biome through
Mm.
antibiotics and things like that. And these mice couldn't regulate their metabolism very well. And they also had altered neurogenesis. So we know that when we take the bacteria out, at least in mice, we have to presume the same in us, that we're taking out a very important part of what creates all that important stuff for our brains to work really well.
And it's important probably to speak about it. And I'm sure you will, like, what we have this symbiotic relationship, but what do they like to eat? Because I think that's where the problem lies, that our diets have changed so much, and what our diets were and what our diets are now are very different. So if this bacteria, viruses, all these organisms, need a certain food, let's say a food source, and we're giving it a different source, then there's going to be a change. Like either they're going to die off or they're going to overproduce some or the other. So I think that's where probably, again, more like the argument of like sugar. If our foods are filled with sugar, and that's not what the bacteria want, that's where maybe yeast is going to use as their source. Maybe that's going to grow more, and then we're going to be full of yeast instead of bacteria that regulates all these important processes. And we got to really feed our bacteria in our gut so that they can, again, maintain that relationship that has caused by their byproducts, all these important stuff. So I think that's why we have to not really just realize we're feeding ourselves, but we're actually feeding the bacteria. Is that correct?
That's exactly right. Because now we really have to think about ourselves as a host organism, feeding things that help us live.
Mm-hmm.
And you're exactly what makes them happy, right? And
Mm-hmm.
also what makes them sad. Because if you think about your traditional Western diet, we tend to eat a lot of processed foods, a lot of foods that have been stripped away of fiber,
Mm-hmm.
a lot of foods that are high in sugar. You find things that are high in sugar that you never expected. We were talking right before we started recording how you like the cranberries, and the particular brand you were liking was full of sugar and you didn't realize it for a long time. And that's true for so many different foods like that you think that they're healthy, but there's hidden ways that people insert the fancy chemical name for whatever sugar is, and it's still a sugar.
Mm-hmm.
And so we know that, for example, sugar in the body, and this is not necessarily a microbiome thing, but we know that sugar in the body does create a lot more inflammation. And then we know that inflammation, we can talk a little bit more about that because I'm going to get sidetracked. But we know, for example, that inflammation, does add to things like Alzheimer's,
Mm-hmm.
does, change immune function, things of that nature. And we also know that people that have anxiety and depression, when you look at the studies, they have oftentimes a low inflammatory response chronically in their body. So cutting down that inflammatory response through an anti-inflammatory diet is really, really important. But we have so many antibiotics in our food.
Absolutely. Yeah. People don't
So
realize that it's not just the antibiotics we get from the doctor for whatever infection or over treated UTI. That's not a UTI. That's a whole different topic. But, it's not just that. It's absolutely the meat, the chicken, everything we eat that is pumped with antibiotics and then is going into our body, into our system. So it's just like us taking a Keflex or whatever we're taking because we are ingesting that food that took that. So then that's absolutely destroying, changing, altering our microbiome and causing the epidemic of antibiotic resistance, which we see every day. And it's very scary when you have everything be an R resistant and you have nothing left. So it's so important that you mentioned that we don't realize the foods that we eat, the chicken from Costco, wherever we're buying it from, is full of antibiotics and how that's impacting us.
absolutely. And so it's all of the things that are hidden in a lot of foods. And even if you're trying to eat a very healthy diet, you still, like you said, the chicken from your generic grocery store, if you're not buying the antibiotic free, the free range, which by the way is a lot more expensive, right? So that brings a whole different category of things that I'm interested, which is
Equity,
food
accessibility.
and the folks that just can't afford that kind of food, right?
Mhm.
So that's a whole different thing. That's a whole different tangent. Um, but we are stripping away that microbiome. So, and then the other things is like, okay, so we're stripping it away, but then how are we actually feeding it? So we're not feeding it much fiber. Western diet, classical Western diet has a very low fiber. We don't really eat a whole lot of fermented foods here in the West. And so bacteria, they like fiber. So your fruits, your vegetables, your high fiber foods, your true whole grains, not the grains that have been stripped away of all the good stuff, right? Heavily processed. And that's the other thing that's hidden, because in a lot of different breads, they'll say whole grain. And I forgot what the percentage is, but it's a fairly low percentage that has to be whole grain in bread for you to be able to brand it as whole grain. So the whole grain bread that you're actually eating is probably mostly not whole grain. So you have to be careful about that too. So it's kind of sinister, but it's out there, right? So we're not feeding them whole grains. We're not feeding them the healthy vegetables. We're not feeding them the fiber. We're not feeding them the fermented foods. But if you look at, even if you're not talking about mental health per se, but even just um, keeping a healthy body in general. So what happens? You feed a high fiber diet to the microbiome. They eat that stuff. That's what they eat. And as they're eating that stuff, that is getting fermented in our body, in our guts. And that fermentation actually supports the activation of L cells, which is a endocrine cell that secretes GLP-1 and other um, other factors that help modulate hunger and satiety. So if you're not feeding them the things that stimulate the things that give you hunger and satiety, where is your hunger signals going, right? So we're throwing kind of everything off because we're actually not giving our bodies what we need in that way.
Yeah, that's so I had no idea about that, that whole process. But yeah, I mean, it seems like there's so many areas where, we are not truly feeding. Again, we never think about feeding our microbiome, but it's so essential because of all the processed byproducts and all the things. And again, it's so important what you said about the labels and really looking at what it is. And we were, not just bread or the cranberries with the added sugars, but, even the oatmeal, which is healthy. We think about, oh, I'm going to have a healthy oatmeal full of fiber. This is really healthy. It's going to lower cholesterol, whatever we think about this healthy food. But again, if it's not an organic oatmeal, it is stripped away with many things or added chemicals that are terrible for us. But you never know that unless you kind of really spend your time to research more. And, again, should it all be organic? Maybe, but of course, there's inequity and accessibility for so many. But the alternative is like we're trying to be healthy, but we're still adding some other things if we don't choose those other options that before were just part of what people ate, but with obviously industrialization trying to feed millions of people, billions of people, there was also the whole concept of processed foods or, more availability because they felt like they couldn't feed so many people with just, free range chickens and cows. So I think there's a whole reason why it happened. But then now that it is here, it's like really being conscious and mindful without going crazy or making yourself crazy, but just trying to make those healthy choices when we're buying the products in the grocery store to try to minimize as much as we can all these added things or things that were taken away that were needed.
Absolutely. And I think it's teaching people how to be mindful without expecting them to do a 180, right? So so I mentioned earlier that I belong to the American College of Culinary Medicine. We're very big on the Mediterranean diet. If you look at the American College of Lifestyle Medicine, they're really big on fully plant-based, vegetarian, vegan diet, right? All of these things are really, really good. But you have to meet people where they are. Eating a vegan diet can be very difficult to get all the nutrients that you need if you're not very, very careful and mindful of exactly what you're looking at and what you're doing, being very thoughtful, right? And if you live in a food desert, for example, that's going to be very difficult to do. I went to the conference back a couple of weeks ago for the American College of Culinary Medicine, and we had all of Saturday. It was a day that we talked about food inequities, which was again one other way that my universe collided with between child abuse pediatrics and cooking. But one of the exercises that we did, which I thought was brilliant, they had us all in sections break into different groups because we did a lot of work in like test teaching kitchens. And I felt like, it was like a Top Chef competition or something, because we're going to win a prize at the end if we made the best food. But basically they had us, they gave us a pantry and a fridge, and everything there had been bought at the dollar store.
Hmm.
And we had to come up with a meal that met the dietary measures of health with what we had. And it was really and everybody, all the groups had to share the things, right? So you might run out or whatever. And it was really to simulate how difficult it can be to actually eat a well-balanced, well-nourishing diet with very little resources. It's doable, but it really takes some education that I don't think that we're giving people. We're not giving that as physicians, for sure. Not in our 10, 15 minutes at the bedside, and we're not really taught that in medical school either. And I think as a whole, because I think nutritional science is and what we now know is fairly new, it hasn't gotten out there quite yet.
Yeah, and it's not so much, even if they make the effort. I mean, there's sadly for those communities or the people with those resources, it's like the time factor, because it's very different to drive to work and back. But many people have to take a bus, which will be another 2 hours back and forth, or maybe in LA traffic, the car is the same. But I'm saying, like, the time that they have or don't have to then even prepare this or have the mind energy of like what to do for these meals that they have to get at the dollar store, because those are their resources. It starts kind of getting smaller and smaller and smaller. So it's not even just getting it. It's like, now, like, if you want to be mindful, it's like, where's that time to do that? So there's so many constraints, because again, the time, because they don't have the resources from all the other social factors of maybe their commutes, their times, or maybe their length of time of their shifts and things like that. So there's many factors why it's challenging. Again, and education is a huge one, and so many people will never get it. And even like I said, as physicians, we get almost none.
Yeah.
And even again with the Mediterranean diet, maybe we can talk about that more, about people that don't know what it is, like, what is it, what does it entail, what does it have or doesn't have, and how that diet has been maybe shown about what you talked about earlier. Some of these foods or foods that you eat or don't eat that can add to inflammation, which we know is not great, especially for the neural mental processes, because we know that the inflammation state is not a great one and can lead to many, many diseases, not just in the brain, but in our whole body. But tell us more about Mediterranean, and for those that don't know, and how we can maybe will understand it, and maybe kind of change a little bit some of the foods we eat to incorporate that.
Yeah, so the Mediterranean diet really is a diet based on foods that you find in Greece and Spain and Italy and that area of the world, Morocco too, so North Africa as well. And it is really heavy in things like fish and olive oil and lots of fruits and veggies, healthy whole grains. Um, there is the red wine component, and then there's a debate about whether it should stay there or not. But when folks started originally looking at the Mediterranean diet, um, they incorporated that because that is part of those cultures, to drink your red wine in the evening. We can talk about alcohol in a little bit, because now we know that alcohol can be so bad for you. So what is it about the Mediterranean diet and incorporating that works? I don't know, maybe it's a different kind of wine.
I think it's sort of like what they talk about in the blue zones. It's sort of the connection. I mean, when you have your wine, when you have your healthy food, there's another component to it, which is the connection you're having. You're not in the iPad or in the phone or not having dinner as a family, but you're having those meals in a culture where people eat together and there's community and there's that bonding. And that bonding and community, I think, is definitely been shown, even in studies, obviously, to increase the longevity and to increase health, because the opposite, which is loneliness, is worse than smoking cigarettes. That can really affect your lifespan. So and I think that that's part of it. And I don't know the studies of exactly adding or not adding the wine, but that's just sort of my take on. I think that is a component of why, is it the wine or not the wine? But I think it's the environment that we're eating these foods. It's not just the food or the adding or removing the wine that may be the factor.
Yeah, and so there's actually some studies going on right now that are looking specifically at the wine in the Mediterranean diet to see if it really is detrimental or helpful, if it's doing anything at all, if it's nulling any of the effects. Should we leave it in and should we take it out? Because there's a lot of questions about just alcohol intake in general, but it could be that there's something about the red wine that maybe
Mhm.
mitigates that. So they're looking at that actively. But I think to your point, these are cultures, and I'm Brazilian, you know, where we take some time to have a meal. It's not very like rushing constantly. So there's something to that. And for the Mediterranean diet, you are really looking at foods that are heavy in your omega-3 fatty acids, for example, heavy in your fibers, heavy in nutrition in general. And they have looked at people that have been in a Mediterranean diet for a long time. And these people have lower rates of type 2 diabetes, have lower rates of obesity, have just general increased longevity, and yes, actually decreased rates of depression and anxiety.
Yeah.
So they looked at Mediterranean diet for 3 years in people and just for measuring anxiety and depression. And these people did end up having decrease in their symptomatology just by diet alone. So we know that there's something there that's really important, that isn't just like, oh, I lost weight, I feel better. No, there's something happen at the neurotransmitter level. And that probably is because you're feeding your microbiome all the things that help create those neurotransmitters that we talked about earlier on. So, when we look at people in the Mediterranean diet with glucose or insulin resistance, that's definitely something that is lowered. And there is an interesting dynamic between insulin resistance and mood. So not only does it add to your increased risk of Alzheimer's disease because of the inflammatory response of the brain, but also it adds to increased anxiety and depression as well, and other mood disorders. And they're not, they think that it is, because if you look at your neurons and your brain likes glucose, right? That's what the cells in your brain like to eat very much. So what is it? Well, it's because in your brain, insulin is modulating that GLUT4 um, receptor for glucose. And so if you're decreasing that, the glucose is not going to have any place to go. And so we know that that causes inflammation.
Right, you have the buildup of that sugar that is not entering. And I think that's, I mean, the thing they're calling it like type 3 diabetes now. That
Yeah.
that is like that causing all these, huge incidents of Alzheimer's and all these neurological, processes that are impacting, which is what they call them the four horsemen or whatever, that, so many things are, right now incurable. And, could the diet, be related or improve it? But I think, like I said, if you lower those levels of sugar, because again, we are ingesting such high levels of sugar, not even just like, let's say candy, things like that, but again, it's so hitting in so many foods. One, I'm always appalled or maybe shocked about the amount of like people's sodas and juices, that they're, and even the alcohol. I mean, it's a lot of sugar. It's just empty calories with sugar. And we just, because it's social to drink alcohol or this or that, or the juice of this, it's just so much sugar per day that we're ingesting that, where's it going to go? I mean, it's going to become, that insulin resistance because it's just so much. And again, that microbiome you're talking about doesn't like sugar. They don't want to eat sugar. They want those fruits, those vegetables, those fiber. So where's that fiber coming into the diet if you're not conscious about adding it daily to your regimen? So it's like we just eat a lot of, I mean, that's sort of like the vegetable we eat is like potatoes or French fries and like a big shake. And so it's like, well, there is no true vegetable or fruit that you're adding to help that balance.
Not at all. And if you remember, your sugar metabolism, so fructose, which is, a lot of what is added, it doesn't get metabolized in the liver the same way as glucose does. It actually goes straight to triglycerides, which, of course, we know that that's going to create more cardiovascular disease and insulin sensitive or insulin resistance there. So yes, you're right. I mean, that sugar, I mean, I like my ice cream, I like my cake, but it is poison. So, enjoy
Choose your
it.
poison. Choose the amount and the quantity and the times that you eat your poison. But yeah,
Yeah.
I mean, it's like I also think you can't be puritanical 100%. And like we live life and we have kids and like it's kind of like, well, you don't give the kid the ice cream anymore. I mean, it's sort of challenging. So you have to kind of live life as well. But I think what would you say for people that, maybe are not ready to 100% change everything, but like, what can you maybe add, slowly, and then just saying, yeah, Mediterranean or more fruits and vegetables? Are there things that you think like people can let me slowly add, or there could be maybe some of these like superfoods, powerful foods, very highly rich antioxidant foods that, could hopefully give some extra benefit, maybe while you kind of get to a more health conscious way? Or what are things that you think definitely should be out or removed or maybe more consciously limit, so to again definitely make that balance with the microbiome, definitely keep our sugar levels and not have these huge spikes so we feel better, not exhausted? What are some easy ways or things that you found that could be helpful for everyday busy people or physicians or or anybody?
Yeah. I think that's the reality of life. We have busy lives. We don't want to super complicate things, but we also want to make sure we're feeding our guts and making sure that we're getting what we need. Now, honestly, not just for our mental health, but just general longevity and wellness, right? Um, so uh, easy, low hanging fruit. We talked about sugar. So, for example, I have a sweet tooth. I love, I love my chocolate. Unfortunately, I don't love my dark chocolate. I love my milk chocolate.
not, not the healthy one in this room, but the other one.
Right. I'll eat dark chocolate. It's fine. But so I think being present to food is important. So enjoy your sugar, but enjoy the sugar for itself. Like I'm going to have a piece of cake and I'm going to enjoy this piece of cake. But be careful of all the stuff that you're buying at the store that has the hidden sugars. Because then you're not enjoying your sugar. You're
You
eating,
didn't realize it's there and you're just eating it.
I'm eating this healthy, whatever cereal that I don't realize is full of sugar. And I think I'm eating healthy. I'm not enjoying my sugar. So, you know, being mindful of what you're buying and being present to when you're doing something that maybe is not the best for you, but you're enjoying it anyway because enjoying life is important, just as important, right? The other thing is that adding the whole foods. So shopping at the outsides of the stores, right?
Absolutely.
Inside the house, right? So your fruits and veggies, your meats, your fish, right? And trying to figure out how you can incorporate those whole foods better into your diet, and staying away from the centers of the store as much as you can. And then being mindful of the processed foods that you're buying for convenience. I'm not saying don't buy them because we live busy lives, but there's actually an app out there that I really like. It's called Yuka. It's Yuka. And you can just look at the barcode and it will pull up for you what foods are really horrible for you, which ones have all the chemicals that they banned in Europe or whatever, versus the ones that are not. So I did this actually recently for tortilla chips, and the bag of tortilla chips that was like supposedly a healthier version that I had in my pantry was full of chemicals that were carcinogenic. Like, oops, I won't be buying that anymore. But what was nice is it gave me alternatives
Oh, that's
for
nice.
brands that actually didn't have those carcinogens, right? So using your technology, there's a lot of different apps like that. That one's my favorite. So that when you're going to buy your convenience foods, you're at least buying convenience foods that are okay, you know. So I think that those are the main things. But I think also being present to what you're eating and thinking ahead of what you're planning to eat. So we eat in our car, we eat in a hurry. We're eating 5 minutes because we have the next meeting or we have the next patient to see or whatever. If we can get into the practice of maybe being more mindful about what it is that we're about to ingest and pausing to make a different choice, even in fast food restaurants or things like that, maybe you're not going to find the best food ever, but you're going to find something better than, say the Big Mac.
Yeah, I also think when you talk about, even just the mindful of like the choice and then kind of going back to even, like our cultures, like, Mexican, Colombian, Brazilian, whatever, especially because I just came back from Colombia and it's always takes me a few days to get over the shock of like how slow it is to just one get the food, even at a restaurant, not a fast food, just a regular restaurant. Like the time it takes to get the food and the time it takes obviously to eat it and you stay, and it's like a very long process. Uh, and it's just because you're like actually chewing the food and you're actually taking your time. And so instead of eating that same meal in 10 minutes, it's a longer process. So you're actually letting your body sort of adjust instead of just getting a spike of partially chewed food very quickly into your body is very different than slowly chewing, enjoying, and better chewed food when you do it much slower. And I know there's a challenge, as physicians are busy, and I just saw somebody in the lounge that like, I mean, it was like like I was like, are you really even chewing that salad? I mean, it's like I think it's going down whole, but it was like just so fast. And we gotta chew our food. That's why we have teeth. And I think evolutionarily, I mean, I forget which book it was that talking about how our faces of our structure changed because we used to actually chew food. And now the food, not only do we not chew it, but it's very soft, like everything's very bland. Because again, we're not eating the whole foods raw or whole, like we used to before. We're eating something very soft, or like the smoothie already, even though it's a fruit juice, but it's like a smoothie. It's very soft instead of eating the orange and the carrot by itself and the kale, and chewing that is very different than just putting in the blender and drinking it in 2 minutes. I mean, your sugar spike is going to be much different than you actually chewing, eating the kale and this and whatever you're going to put in it. So I think the time we spend and the actual chewing process and the time we spend and the activity of eating, I think definitely is also very important. And obviously the choices, like once we can choose and be more mindful of, even if you are in fast food, like what could be the better. And learning to read labels, I think is huge too, because so many people don't know that sodium is actually salt. I'm like, I tell my patients, don't eat salty foods. And then they don't know that actually the sodium means salt. Or again, the added sugars, it says added sugars, and how to read those labels is crucial, like knowing what to buy. And even you kind of have to get OCD and read like every little detail, or use this Yuka app to help guide you a little bit more of like, yeah, maybe this is not great. So again, using that technology can be helpful, but also using our own awareness and our mindfulness also very important.
Yeah, and just like little things, simple tips. So for example, if you are, making yourself a tuna sandwich and you open up the canned tuna, there is a very high sodium, but if you actually wash the tuna, you're
Hmm.
cutting out 60% of that sodium.
Hmm.
But we often don't think about like washing the tuna from the can because it's already in a can, so it's clean, right? But you're not thinking washing it for cleanliness purposes, you're washing it to get rid of the sodium. And even you mentioned eating the orange. So for example, we know that, um, of course, with chronic stress, you have a higher degree of cortisol being released in your body pretty constantly. Well, if you look at the studies on vitamin C actually helps modulate cortisol in high stress environments. So, you're running around stressed out crazy that day, put an orange in your purse, like how modulate
Lower
that
it.
with your orange. Um, so little things like that, those two things that I just mentioned are not difficult, but these are things that we're not taught.
Yeah, and I think also, what not so much what we eat, but also what we're drinking, and also the fact that we don't drink enough water. Maybe isn't the urology in me, but so many people don't drink enough water, and we're like 60, 70% water beings. Like we're mostly water weight. So we need to replenish that water. We need to like use that instead of sugar and all the other sugary drinks. But water is essential for life. It's so important. We don't drink enough of it. And then also, if you're dehydrated, then you get constipated, you get, dizzy, you get all these other problems because you're not drinking enough water. It's so easy. It's mostly free for most of us, and it probably is healthier than the bottle. So water is also, I think, key and just how we feel. And like we just don't feel well when we're sluggish and constipated. We just don't feel good. So the water, I think, is also really crucial to think about, which is kind of so simple and overlooked, but it really is important to drink it and to use that instead of other choices.
Absolutely, absolutely. And other things that can be done is so adding fermented foods to our diet. So
Yes, oh, I'm so glad you brought that up. Yeah, because you touched on it. Please tell us why this is important. And for people that don't know what fermented foods may be, what are some examples and why are fermented foods important? Because yeah, this is crucial too. I'm glad you brought it up.
so your yogurts, your kimchi, your uh kefir,
Sauerkraut. Mm.
sauerkraut, pickle things. Those are fermented foods, and they're important because our bacteria, once again, they really like them.
Mhm.
And it's an easy way for us to get a lot of pre and probiotics. So prebiotics are the carbohydrates that the bacteria like to eat, and so you're propagating that healthy growth of bacteria. And then, of course, probiotics are live cultures that are in the fermented foods, so that you're actually replenishing that microbiome. So that's something that's another thing that's kind of easy to do. You add sauerkraut to your meal, you grab a yogurt for your snack, you maybe put some blueberries in it for those polyphenols, and you got yourself a pretty good snack there that is going to really help your gut.
Yeah, I
Um,
love that. Yogurt, so I think is essential. And also as a urologist, yogurt, one of the important properties of yogurt is it has probiotics, as you mentioned. And if you have kidney stones, for example, it lowers the oxalate. So when you have high oxalate foods, the calcium and the probiotics all lower that oxalate level so you don't get kidney stones. So yogurt helps you for digesting, obviously. It helps you poop, but that's very important. So, that's very easy. And also, I would say choose the kind of Greek yogurt. They're not the like full of sugar, even though it's healthy, but there's definitely different types of yogurt. So try to
yeah.
choose a more healthy one. And if not, you can maybe add honey or maybe some more natural kind of sugar to it. But yeah, yogurt is fantastic. So thank you for bringing that up.
Yeah, I think the other thing too is, I think especially those of us who were children of the 80s and such, and we're dating both of us here, but
We have like the same birthday almost, but yes.
you know people used to say, oh, eat low fat, eat low fat, eat low fat, right?
Mhm.
Don't eat low fat. Eat healthy fats, eat
Mm.
your avocados, sprinkle your olive oil on thing. I was looking at avocado, for example, has a good deal of tryptophan in it, which, as we said, is the precursor to serotonin, which bacteria like to help along that pathway. So yes, eat your guacamole that maybe you made at home with your all your other good things like onions and garlic and things like that. So don't forget the healthy fats. Don't be scared of fats. Stay away, of course, for trans fats and saturated fats. But the other things are important for um, being able to absorb lipid soluble vitamins, to be having other kind of mechanisms in your body. Our brain, of course, we know that myelin is made of fat, so it's very, very helpful. So healthy fats, lots of fruits and veggies, staying away from the sugars, adding the fermented foods, water, like you said. And those are the basic rules. Any kind of healthy anti-inflammatory diet that you follow out there is going to follow those basic rules.
Yeah, I mean, I think that the healthy fats are so easy in a way with the avocado, because it's actually a fruit, and it's just so easy to add to so many things. For breakfast, you can put the avocado. I think they do like avocado toast. In Latin countries, they use it with everything. But for lunch, you can have it. You can have a snack. Dinner is something easy you can add. So it's very easy to add and make it healthy, and it's actually filling, and it has all those properties. And I also learned recently that if you scoop it, when you scoop that kind of area close to the peel is where a lot of these nutrient things are. So, scooping it can be a helpful way to kind of capture all the good things from it. I mean, I don't know what other way to do it, but I think that's how most people do it. But I read that. I'm seeing here Ronnie talking about like eating enough protein is important too. I mean, what's your take on the protein part of all this for overall health, but obviously mental health? Like, what's your take on the protein?
Right. And we didn't really talk about your macronutrients in this talk. But that's going to be really important too. Like you're going to want to make sure that you maintain, 20-25% protein in your diet. Or some diets are going to be heavier protein than others, depending if you're, more paleo or if you are keto or something like that. So play with your body. But yes, getting lots of protein is important because it's the building block of your bones. It's going to be a building block, obviously, of your muscles too. So having a well-balanced grid of your macronutrients is very important. Um, and and I think that's why people say like eat a balanced diet. Um, there's going to be some nuance, honestly, as far as when you get to the nitty gritty of how much a person needs, a little bit on your genetics, and I mean we don't really have time, but we can talk about epigenetics and nutritional epigenetics, which is a growing field where they actually look at your genes and like, oh, you have a predisposition, for obesity, or you have a predisposition for such and such a thing. This is what your diet should look like. It costs thousands of dollars to do those tests, but it's fascinating, right? But when you look at how each individual is genetically made, your body's going to process different things differently. Just like anecdotally, I do terribly on a ketogenic diet. I feel awful. But if I just do like a low carb diet, because I have a predisposition to diabetes, I had gestational diabetes all three of my pregnancies. My pancreas is like, no, don't do the bread, don't do it, even though I love it. But I know that for me, there's that happy medium of a little bit of a higher protein, lower carb diet, but I can't go too low on one end or the other. So that's the other thing too, is knowing the basic average standards, but being willing to kind of play with your body and what your body feels like within those standards.
Yeah, that's crucial because I think, yeah, unless it's more affordable for everybody to get these tests, now, which is not, maybe in the future, we will maybe able to get more individualized information, even the healthy foods or things that we may choose, or if it's like blueberries, some people may not digest that as well. We have to think about that and put that into consideration that even though it may be a great food source, that maybe we don't use it and we have to use an alternative, and we're all different, even in the same household, we may have some differences of how we feel or process, and just getting to know your body, that's just maybe something I want to eliminate or not add, and looking for an alternative. It's really important, and you got to kind of honor that. So I love that you brought up the individual part, and obviously so many advances with technology, that hopefully could be more you know, affordable, yes, and accessible to many. But if not, then just trust how you feel.
Yeah.
If you don't get to that point where you get that test, so just trust how you feel and follow that. So, Brita, you talked about obviously the resources of the app with the Yuka. I mean, is there any other websites where people that want to learn more about some of these concepts that they can go to? What's the best place, people that want to know more that you can point them to?
So two that come to mind that are my particular favorites. I love the American College of Culinary Medicine. You
Mhm.
can go to their website and they have 5 bajillion healthy recipes of all different varieties that you can look for, and some really great resources. Another website that I really like is called Old Ways, all one word. And why I love this is that they teach healthy eating, but they are also culturally sensitive. So, the Mediterranean diet, for example, is wonderful, but it's very European centric. and doesn't take into account all the other many other wonderful foods that you can find all over the world. And so that particular website has actually built food pyramids based on cultural regions and their foods, and that's fascinating. So I went to like the Latina heritage portion of the website, and like, how is this food pyramid built, and what does it incorporate?
Yeah.
um, and they have it for many of places around the world, and so it's super neat, especially if you have that cultural slant and you're trying to incorporate your traditional foods into a more healthy diet, healthy
Yeah,
meal.
I love that. Yeah, we were talking about, our cultures and, we eat a lot of meat and things like that. But then we talked about the difference, I think, is that, for Colombia, not Colombian, but my husband is, but like the Colombian cows or the Brazilian cows, I mean, they're like free range grass eating cows. They're very different than the US cows that are packed together and are eating just grains and in the different very different diet. So I think that the cows that we are eating, if you're going to eat meat, and I'm not against meat, I'm just saying that if you're going to eat meat, it's very different, not only what it tastes like, but how they're raised and how they're bred and what they're eating. And so it can vary, not just culturally, but where and how these cows or animals are bred. So very very fascinating because it's very different.
Yeah, and that's a whole different. We can keep talking about
I
food for
know that's very
okay.
interesting. The Colombian cows are different than the American cows. But Verena, you talked a little bit at the beginning about, your work as a pediatrician, and I know you were obviously a coach of trauma-informed coach and culinary coach and many, many aspects of coaching. And, you know, how can people really find you? And also tell them a little bit more about your podcast, which I love. And I love the premise and the education you're doing through that and through your social media platforms, really raising awareness about all these very challenging and very important topics to bring to light. So tell people more about those projects that you have and how to find you.
Yeah, thank you for that. So my coaching business, I'm Sentient Anatomy, and that's also the name of the podcast. The podcast, we cover many different topics, a little heavy on female sexuality and sexual health because I do a lot of sexual abuse at work. But other topics that include wellness. You've been on my podcast talking about burnout. We've had another physician came in and talked about Ayurveda, things like that. So it's fairly broad when it comes to healing and wellness in general. And then, yeah, there's a couple of different coaching things I do. So I'm a trauma-informed sexuality coach, health and wellness coach as well. And you can find me at www.sentientanatomy.com, and my email is sentient.anatomy@gmail.com.
Perfect, lovely. Yeah, I think so many people can definitely benefit from, the support and just the information. And I recently saw one that you were, explaining about the hymen and this whole myth about virginity. So all this information that, kind of is taboo, but it's so important to understand from somebody who's an expert and who has really has this knowledge and is trying to demystify all these taboos and things that are not helpful for women or society. So thank you for all the work you do in your day job and everything else that you do, and for coming here just to explain more about the fascinating interplay between the microbiome and our brain health and our overall health, and how it's so important, not just to feed ourselves but to feed all the living beings inside of us. So thank you so much. I really appreciate your time and just all that you shared.
Well, thank you so much for having me, and shout out to everyone that showed up tonight. I know Ronnie, so hi, Ronnie. Thank you for coming. And this has been a pleasure. This has been so much fun. Thank you.
Thank you.